This is the tapotement or percussion massage. Before I start, I would say that normally we would warm the patient up and introduce them to touch and build some of that therapeutic alliance with an effleurage, like warm-up massage. But for today's purposes, I'm just going to go straight into the tapotement. Basically, what it is like a massage that uses rhythmical blows that alternate back and forth with loose wrists, just to try to bring some increased blood flow to the underlying tissues and facilitate that underlying muscle, subcutaneous tissue, and hopefully it will just bring some relaxation to my patient. With patient positioning, I do want to do this on his back, so I am going to have him prone, and I want to make sure that he feels like he is properly draped with his shirt off, so I would make sure that he's okay with that too. And then before I start with precautions and contraindications, I want to make sure that my patient doesn't have any kidney problems, especially if I'm going to be on his back. I'd want to make sure that he also does not have any fractures or sensitivity to touch, and doesn't have any inflamed tissue. If he has a infection or like some sort of inflammation or fever, I'd probably avoid this too. And depending where I am on the body, I'd want to avoid if they have a thrombosis or if someone's pregnant, especially like positioning that I'd put them in or where I would touch them. I just want to be careful with that as well. And yes, I do want to avoid doing it over bony prominences as well. And I think that's about it. So the first one is ulnar hacking. So you're going to use the sides of your ulna, and I would have the table up a little bit higher, like to my knuckles, so I don't have to bend, but for my purposes, that's what I'll do. So we're going to start distal proximal, and we're just going to do rhythmical, like ulnar chopping, basically, just keeping my wrists relaxed and getting that like alternating movement. And the next one is beating, so it's like a half fist, and same thing, just keep your wrists relaxed, and you're just doing a percussion massage. And we don't want to go over any bony prominences. And then the third one is cupping, and this is for like postural clearance, like airway clearance. So we want to do it in the upper back, and so you have face down palms, and you're just help facilitating that clearance of the airway if they have it. And so while we're doing this, we want to make sure that we're looking to see, am I causing more pain to him? Because if I am, we would want to stop. Also, since we are trying to increase blood flow to the area, I do want to make sure I am hitting him like hard enough. So like if he has some redness or some warmness, like that's normal, that's good. That means we are increasing blood flow, but we just don't want to make it too excessive or cause any pain.